So this is about understanding Lyme disease and understanding a little bit about the connection between Lyme disease and mast cell activation syndrome as well, and how the two can sometimes be interconnected. And we're going to explore a little bit about that as well. But I'm going to start off the beginning will be about Lyme and just straightforward information about what Lyme is and how we can understand Lyme disease and maybe begin to spot it. So this is who I am. For those of you who don't know me, I'm a naturopathic nutrition and health coach. I do psychotherapy, mindfulness, and also integral eye movement therapy for people with chronic illness. But I also live myself with Lyme disease and mast cell activation syndrome and dysautonomia and chronic pain as well. So my lived experience has informed everything that I've put into this talk tonight. So just a little bit of background information really on why we should all be understanding Lyme disease, not just within this community, but I really believe very strongly that everybody in the UK should be understanding Lyme disease. And once you've listened to this talk tonight, I hope that maybe you will be able to talk to your friends and your relatives and make them aware of Lyme disease as well. And you'll understand why it's so important that everybody becomes aware of Lyme, because cases of Lyme are on the rise across the world, and ticks carrying Lyme disease are now endemic across the UK. And there's about 3,000 officially recorded cases in the UK each year, but actually that, as we'll see as we go through, that's a very underestimated figure. And in the United States, more than 476,000 people are infected with Lyme. And again, that is a very conservative figure because of the way that Lyme is not picked up and not recorded. But the thing that we need to be aware of is by 2050, the projected figures are that around 17% of the European population will be infected with Lyme, which is 134.9 million people. And that is the, official government figures for the projected projected infection rates. So it is the most common tick-borne disease in the Northern Hemisphere, and it can affect adults and children of any age. So it's very important to be aware of Lyme disease if you have children. But there is a lot of confusion about Lyme disease. There's a lot of controversy around it, and there's a lot of misinformation and a real lack of information. And it's considered by many people who understand Lyme disease to be a real emerging global health crisis. Dr. Tanya Dempsey, I'm sure many of you know her. She's very well known in the mast cell activation syndrome world. She calls Lyme disease a silent pandemic because it has very profound and long-term implications for many people who get it. And so it's really important that we all become very aware of Lyme and how to protect ourselves. So I mentioned there really that it's a complex and controversial subject. So I start off with this disclaimer that there is a lack of understanding really that requires more research to be done. So what I'm sharing tonight in this talk is largely based on the Royal College of GP's Lyme Disease Toolkit and also the information that's in the NICE guidelines, and lots of other research papers and reputable Lyme disease authorities. And I've included a lot of references and research papers that I've used to create this talk. So none of this is made up. None of this is based solely on my own opinion. I've used a lot of very credible sources to give you this information, but a lot of it is still considered to be controversial, even though it appears in these very well respected authoritative studies. So according to the Royal College of GP's toolkit, this quote here at the bottom, there is ongoing medical and scientific uncertainty and conflicting opinion in relation to many aspects of diagnosis and treatment of Lyme disease. And there is a recognised need for further research in order to address core uncertainties and improve patient outcomes. So that statement there really just shows that there is this controversy and this lack of understanding that is recognized in, the Royal College of GPs recognizes it. It's recognized in many places that Lyme disease, our understanding of Lyme disease, still has a long way to go, particularly in mainstream kind of conventional medicine. So I also want to just say that I don't want this talk to be the cause of any anxiety or panic for anybody. This is information that we all need to be aware of and that we all need to learn, because that empowers us to make good choices about how to protect ourselves and our families from Lyme. As I said, it's really important that we understand this, but that we don't worry about it unduly. We just need to take this information and use it to help us to keep ourselves and our families safe, but not to be unduly worried about it. So just to touch here at the end, as I say, I'm going to talk more about the fact that there is evidence that Lyme and other bacterial infections like Lyme can trigger mast cell activation syndrome. So some leading US Lyme doctors recognize MCAS as being a factor in around 50% of their Lyme patients. There's a lot of overlap there. And as I said, later in the talk, I'll be looking at the evidence for that. But I always feel, based on my own personal experience, if you can't identify external triggers for your MCAS, if you're doing everything you can to control your diet and your environment, and it's not making a big difference to how poorly you are with MCAS, and you can't get your symptoms under control, I really think it's important to consider the possibility that there may be an internal trigger, something like a bacterial infection like Lyme, that might be playing a part. And as I said, we'll look at that more later. So just very briefly, to give you the background, my story, in between 2017 and 2018, I was working all over the country in woodlands, delivering events and engagement, and I loved it. It was an amazing job. You can see me there inside an ancient tree, and it was just fabulous. And in early 2000, I remember noticing this huge bite on my leg, which my mum and I had a good joke about, because we thought, goodness me, whatever it was that bit me, was it an elephant? And we laughed about it, and I never thought any more about it. But I do know that in February 2018, I missed my friend's 50th birthday party because I was in bed all weekend with what I thought was flu. I just had a nasty cold, a fever, a temperature. I remember I couldn't work. I missed her party. But by the end of March in that year, I had become catastrophically ill with a complete range of systemic mystery symptoms. I was experiencing complete insomnia. I completely lost the ability to fall asleep. I had racing heart, tachycardia, excruciating chest pain. My heart was inflamed on scans. I had brain fog, memory loss. I was twitching all over and having unexplained muscle spasms and neurological symptoms like numbness and dizziness. And I had episodes of seizures. My lymph nodes were enormously swollen all over my body. I was covered in bruises and rashes. I had visual disturbance, visual migraine, tinnitus. I was completely non-functional by that point. I lost my job. I couldn't drive. I couldn't leave the house. Most days I was just bedbound. I couldn't function enough to do a jigsaw for an 8-year-old that my friend sent me through the post. I was completely unable to function. And nobody could explain to me what had happened. Nobody could explain to me what the matter was. After about 8 months, I realized I'd got MCAS, and I found the right doctor to help me with that. And I got on some MCAS drugs, which helped me a little bit, but it didn't really resolve the issue. And I couldn't understand why I developed such severe MCAS practically overnight. So I kept digging, and it took 2 years to be diagnosed with Lyme disease, and then a further year after that to get on the right Lyme treatment. So for me, I realized eventually that it was Lyme that had triggered my MCAS to become severe. I think I'd always had it mildly looking back, as many of us can see. We were always a bit sensitive, a bit allergic to things, but it never bothered me unduly. But when I caught Lyme, the MCAS really took off and became really, stratospheric. So for me personally, treating Lyme disease has significantly improved my MCAS and reduced my MCAS symptoms, which is why I'm really passionate about sharing the connection between the two. So what is Lyme disease? What are we talking about here? So Lyme disease is a bacterial infection. It's an infection with the bacteria Borrelia burgdorferi, and the bacteria are spiral in shape. You can see the picture there on the screen, this sort of funny wiggly lines that are actually under a microscope. They're spiral, and they're known as spirochete or spirochetal bacteria. And it's the same type of bacteria as syphilis. Syphilis is also a spiral bacteria, and there's a lot of overlap in the way that these two types of bacteria behave in the body. And so the fact that they are this corkscrew form means that they can burrow really deeply into tissue. But there's also studies now, and you can see the research for that on this slide, that the Borrelia spirochetes can mutate into what's known as a round body form. And when they are in this round body form, they are resistant to antibiotics. So a 2016 study found that antibiotics left 68% of the round body Lyme cells alive. And it also induced the spirochetes to morph into round bodies. So what we're saying there is that when people take antibiotics for Lyme, it provokes the Lyme disease as a defense mechanism that they can switch shape into this round body form, which is then resistant to antibiotics rather. So you can see there, we're beginning to understand why Lyme can be so tricky to treat and why there's such a lot of confusion about Lyme disease. So how do you catch Lyme? So you get Lyme disease by being bitten by an infected tick. It is a tick-borne disease. So ticks are a member of the arachnid family. They're a member of the spider family. They have 8 legs, and you can see a little picture of one there. So ticks are found in any area where there are wild animals on which ticks could be living. So birds included, and any animals, hedgehogs, any kind of wild animal can be carrying ticks. And they exhibit what is known as questing behavior. So they feed on the animal and then they drop off and they just sit on grass, on logs, on stones, anywhere where they can just sit until another warm-blooded creature brushes past them, and then they latch onto that. So that's their questing for another meal to walk past, which could quite often, quite easily be an unsuspecting human being. So, as I said there, deer, squirrel, rats, birds, any animals can carry them. And there is a myth that has been talked about. It used to be thought a lot that a tick had to be attached to you for at least 24 hours in order to transmit Lyme. So if you removed the tick very quickly and immediately, there was no danger. Unfortunately, there is no evidence for that, and there is no minimum time for a tick to be attached for there to be the possibility that it can transmit Lyme disease. And a lot of people still quote that old out of date information, and they're not aware that that is now out of date. So there's some controversy around the fact that some evidence seems to show that Lyme may also exist in other biting insects, and this is quite a controversial area. Some people feel that it's possible that things like mosquitoes might carry it. Other people say that because of the mechanism of transfer, it needs to be a tick, and this is one of those areas where that ongoing research is needed. So ticks can be found anywhere, in gardens, in parks, in woodlands, anywhere where there's long grass, leaf litter. This time of the year in the autumn, there is a second peak of tick activity in the autumn, and leaf litter is a place where they like to lurk. But, fallen logs, tree trunks, stones, rocks. So you can see that you need to be vigilant really anywhere in, when you're outdoors. But it is important to say that not all ticks carry the bacteria that causes Lyme. In the UK, the estimated figure is between 4 and 10% of ticks are infected with Lyme. So you can be bitten by a tick and not catch Lyme disease because that tick does not have the Lyme bacteria. So it's important to be vigilant and to understand this, but not to, this is one of the reasons why it's important not to be overly, panicked by it, because not all ticks carry Lyme. So there are 3 stages in the life cycle of a tick. There's the larva stage where it's, a little larva, and then it hatches into a nymph tick, and then it grows into the adult. So the picture there on the screen is of a nymph tick, and you can see on the very tip of somebody's finger. So nymph ticks are the ones that are most likely to bite us, and most cases of Lyme disease are transmitted by nymphs. So you can see by looking at the size of that nymph tick how easy it could be to be bitten and not notice that, because it's these small ticks that are, potentially carrying the Lyme. And because of climate change, as I said, ticks are now present throughout the UK. It used to be thought that, Scotland was a hot spot, Thetford Forest, and down in the New Forest, people used to say you could only catch Lyme disease in those places. But unfortunately now, because of climate change and the fact that the climate is now warmer, ticks have spread throughout the whole of the UK, and they are active all year round. They're most active between April and July. And then, as I said, there's a second peak around the autumn where they get very active again, but they are present all year round. And there are people who have been infected by being bitten on Christmas Day in the UK. So at any time of the year and in any place, I know somebody who was bitten in their garden in Essex. So it's not just in the wilds of Scotland, it's not just in the woods. Ticks are anywhere where there are birds and animals. And as I said, you can see there that the nymph ticks are very small. The main vector in the UK is Ixodes ricinus, or the castor bean tick, also known as the sheep tick or the deer tick. It's a type of hard-bodied tick. So that is the carrier, if you like, of Lyme disease. So some facts about tick bites. As we've just discussed, you can be bitten by a tick and not realize it. Many people with Lyme disease don't remember a tick bite. According to the Royal College of GPs, only 1 in 3 people will notice the bite. And you can imagine if you got one of those little nymph ticks in your hairline or in your belly button or on the back of your knee, so easy to be bitten and not realize. And as I said, you can be bitten anywhere, in your garden, in parks, in urban areas, on sand dunes. Ticks have been found on beaches. So it's not just wild areas. And it's really important to emphasize that you can be bitten by a tick on any part of your body, and both men and women have found ticks embedded in some very undesirable places. So when we say check thoroughly, we mean really check very thoroughly. As I said, they will get inside your belly button, inside your ears, and in genital areas. So be very, very vigilant for ticks. The other thing that means that people can be bitten and not realize is that tick bites are usually painless and they don't generally itch. So this is the thing, we think we would know if we were bitten because it would be itchy, but actually tick bites are not generally itchy. However, it's important to say that sometimes there may be a second response, a localized histamine release at the site, which is itchy, but the tick bite itself is not itchy. So there's a bit of confusion there. And some people say, well, I was bitten by a tick and it was itchy because they had a bit of histamine release there. But the tick bite itself, when mosquitoes bite us, they inject something into us that makes it itch, but ticks don't do that. So the bite itself does not itch. So it's worth knowing that adults tend to be bitten on the lower half of the body, so in our groins and our legs, our ankles, behind the knees, because obviously that's the part of our body that is brushing up against the wildlife and the foliage. Children, on the other hand, tend to be bitten in the head, in their hair and their upper body, in their ears, behind their ears, around their hairline. You often see ticks embedded in children's hair, and obviously in the scalp, covered by their hair. It's very, very easy to miss a tick bite on a child. So it's important to check if they've been playing out, because children tend to put their heads down and rummage about and they roll about on the ground much more than we do as adults. So they tend to get bitten in their upper body. So check really thoroughly, particularly around the ears and the hairline on children. So a little bit about the history of Lyme disease. Where did it come from? It is Lyme disease, not Lyme's. People who have Lyme disease get quite picky about that because people who should know better mispronounce it as Lyme's. It is Lyme disease, and it's named after the town of Old Lyme in Connecticut in the United States, which you can see on the map there, sort of halfway between New York and Boston, roughly. So in the 1970s, around Old Lyme, lots of children developed very mysterious symptoms that were thought to be arthritis. It was a type of arthritis, and that was the first modern recognized incidence of Lyme disease. They realized that these children must have been infected by something because there was an outbreak all around the town, but they didn't know what was causing it until 1982, when the scientist Willy Burgdorfer, which is why we call it Burgdorferi, he was the first person who actually identified the spirochetal bacteria that was causing this arthritis-like symptoms around Old Lyme. However, a variant of the Borrelia burgdorferi DNA has been identified in the Ice Age mummy Ötzi. Some of you may have heard of him. He was discovered in the Australian Alps, Austrian-Italian Alps. He's about 5,000 years old, this mummified man, and he was carrying a form of Borrelia burgdorferi bacteria. So the Lyme bacteria has been around for many, many centuries, but it's becoming more prevalent now and more widespread. So you can see here on this map, the areas that are dark grey or black are areas where there are ticks carrying Lyme disease. So you can see that it is really endemic across the whole large areas of the world, really the whole of Europe, certainly the whole of the UK there, and large other areas, South America and Australia. North America is in a subnational level in a lot of states, but it is spreading and it is becoming more widespread. And they found the antibodies to Borrelia bacteria in penguins in the Antarctic. So it is it is there as well. It is in the Antarctic because the penguins have been exposed to Lyme disease living in the Antarctic. So it's very widespread across the whole world, really. So precautions to help you to prevent you from being bitten by a tick. So there are repellent sprays, and some of them, are quite nasty, strong chemicals, but there are some that are made with natural essential oils, and there are, substances that you can spray that repel the ticks. It's important whenever you're going out in wild areas and walking through grasslands and woodlands to cover your skin. So no walking through grassland in shorts and flip-flops, and to tuck your trousers into your socks. I know it's not a particularly great look, but it does prevent the ticks from being able to get up your trouser leg. So you should, tuck your trousers into your socks, or wear long boots like this lady is there so that her leg is completely covered. Avoiding walking through long grass and overgrown areas, stick to the paths, don't thrash through the undergrowth, and, brushing past vegetation is going to put you more at risk. Or sitting in amongst vegetation, sitting on logs, sitting in the autumn leaves, that's all going to put you at more risk. The advice is also to wear light-coloured clothing like this lady is there, because you'd obviously see a tick more easily. And if you see a tick on your clothing, you can brush it off before it attaches to you. And as I've said, carrying out really thorough checks, especially on children, but also on yourself whenever you go out, and your animals as well, your pets. Go whenever you're going walking, whenever you've been out in the park or out in the garden even, just check and make sure that you haven't got any ticks on you. Pet owners, according to the RCGP Toolkit, pet owners are 1.5 times more likely to be bitten than non-pet owners, because animals, will pick up ticks and brush past them in the garden and lay in the vegetation and then bring them in, and they fall off in the house, and then they're questing in your carpet, and so, they will attach to you. And the other thing to be thinking about is changing your clothing promptly whenever you've been out and about in undergrowth and walking through outdoor areas. Change your clothes and put them straight into the washing basket. Don't leave them lying around on beds. I know of one lady whose husband was an outdoor worker, and he came home and threw his clothes on the bed, got in the shower. She got into bed and was bitten by a tick in the bed, which had come off his clothes. So that, is something to be thinking about when you've been outside. So it's absolutely critical to remove the tick correctly in order to reduce your chances of being infected by Lyme disease. So you need one of these tools, the little green things there with the 2 prongs, that's known as a tick twister, or the alternative is a pair of tweezers with a very sharp, very fine nosed, so not blunt tweezers, and that's very important. So the reason for this is if you squeeze the tick as you're trying to get it out, if you make the tick stressed, if you make the tick angry, it will vomit. And the more it vomits into you, the more likely it is that it will transmit Lyme disease to you. So it's very important that if you find a tick, you have one of these tools and you remove it correctly. So there's a link there on the slide to a YouTube video. If you Google YouTube tick removing tool, you will find this video that shows you very clearly how to use this. And I would recommend, they cost a couple of pounds really on Amazon. Purchase a set of these tick twisters and have them about your personage in your handbag or whatever. So if you find a tick on you, the quicker you can get it out, the more you do reduce your chances of getting Lyme, and you need to get it out quickly and easily and smoothly. So people years ago used to say smother it with Vaseline or burn it. No, because that's going to make it vomit. You're going to make it stressed. So very gently just pull it out, and the tick tool, you twizzle it round and you just pull it straight up, and the tweezers, you grip it as low down as you can possibly get to your skin and pull it straight up. So there is a service, there's a company in the UK that does test ticks for Lyme. So if you find a tick on you, you can bag it and send it to them, and they will test the tick and tell you whether the tick is infected with Lyme. So that doesn't necessarily give you a huge amount of information, because it's possible that it may not have transferred the Lyme to you. You may have got it out quick enough. It's possible that if it comes back negative, you may have been bitten by another tick that you didn't see, and you may still have Lyme. So it's a little bit of a grey area really as to whether that's worth doing. But if it puts your mind at rest and you feel you want to, you can send the tick away and get it tested to see whether or not it's carrying Lyme, which at least gives you some information. So this slide is where things get slightly more controversial, and I need to be clear that there's a lot of still discussion around these points. I have put some articles and some research papers there which shows the information that I've used to create this slide, but it is still an area where ongoing research is needed. So Lyme disease does cross the placenta in utero and can infect an unborn baby. So the research that first proved that congenital transmission was possible was done in 1985. up until 2020, the world organizations and the Center for Disease Control in particular in the USA, were denying that it was possible. And if you speak to a lot of, conventional medical bodies, they will still say that it's not. But unfortunately, the research is now showing that it is possible. And in 2020, the CDC in America did update their guidelines to reflect the fact that it is possible to catch or to pass Lyme to your unborn child. So this is something to think about if you have a baby that was born that, if you think you may have Lyme and your child is also poorly, it's worth considering the possibility. And as I say, it's a controversial area. It's still something that is not widely recognized, but it seems from the research that as though it's possible. Again, something else that is controversial, and more research does need to be done on this, but some people believe it's possible that Lyme disease may be sexually transmitted. So a 2014 study found live Lyme disease spirochetes in semen and vaginal secretions of people who had confirmed Lyme disease. So if you think about the fact that the spirochetal bacteria is very similar to syphilis in the way that it behaves, there are people who believe that they have been infected through their partner, and as I say, more research is needed, but it is looking possible from the research that may be potentially possible. And then finally, again, more research is needed in this area, but a 1990 study showed that Borrelia bacteria had survived in blood that had been processed for blood transfusion. So the NHS does not currently screen blood donations for Lyme disease, and it's something that, again, more research is needed on that subject, but it's important to be aware of the possibility. And, as I said, more needs to be done really to explore that. So ticks are known as nature's dirty needle because it's not just Borrelia burgdorferi that they carry. Around 50% of people with Lyme also have what's known as co-infections. So the ticks carry all sorts of infections inside them. So there are other bacterial infections like Bartonella, Mycoplasma, Ehrlichia, Anaplasma, Yersinia. Babesia is a type of malarial parasite that is also transmitted via tick bite. And in 2019, here in the UK, the first recorded case of tick-borne encephalitis was also recorded. So ticks do now carry that as well in the UK. So when you're bitten by a tick, it is possible to get a bit of a cocktail of infections, and I certainly was positive for a number of different infections, including Lyme. And for a lot of people, it can be the co-infections that are driving the symptoms, and this is one of the areas where it gets quite confusing with the treatment of Lyme, and people don't get better when they've treated for Borrelia, but it may well be that they haven't treated for Bartonella, for example, or Babesia. And for me, certainly it was Bartonella and Babesia that were driving my symptoms largely. Bartonella is particularly difficult to eradicate because it has a very quick life cycle. So it's growing and reproducing faster than you can kill it. And it does cause particularly nasty neurological symptoms and mental and emotional symptoms. So people who have Lyme that is very neurological quite often have a Bartonella infection as well. So people who, as I said, have, symptoms that are resistant to treatment, it may be because they are not treating the co-infections as well, and that's always important to bear in mind. And as I say, there's research there on the slides that shows, that talks about the co-infections. So the symptoms of acute Lyme disease, this is taken from the Royal College of GP's Toolkit. And they say the Borrelia bacteria disseminate quickly around the body, causing widespread multisystemic symptoms. So your initial symptoms when you first had a tick bite might be flu-like symptoms, fever and sweating and, runny nose, and you may have swollen lymph nodes and fatigue and pain. And you may have something that's called an EM rash, which I'm going to describe a little bit later. It might then spread, and you might get migratory myalgia, arthralgia, brain fog, headaches, paresthesia. So migratory myalgia and arthralgia, pain, joint pain and muscle pain that moves around the body, brain fog, headaches, and neurological symptoms, numbness and tingling. So symptoms of Lyme disease, this is the RCGP toolkit, goes on to say symptoms of Lyme may include the nervous system, joints, skin, heart, and eyes. Lyme disease is known to adversely affect the immune system, which may result in a relapsing, remitting clinical picture, which is often characterized by pain and fatigue. And so this idea that people feel a bit better and then they feel worse and then they feel better and they feel worse and their symptoms migrate and they have lots of different symptoms. One day it might be a headache, the next day it might be joint pain, one day it might be joint pain in their arm, the next it might be joint pain in their leg, they might have problems with their eyes, their skin. You know, this is a very familiar, very kind of diagnostic picture of how Lyme presents. So the RCGP toolkit goes on to say that in the UK and Europe, disseminated Lyme, that's Lyme that has gone past the sort of the very acute phase and has spread, is more likely to affect the nervous system, with the potential to cause a wide range of diverse neurological symptoms. In North America, the type of Lyme that they catch there is more likely to cause the arthritis. So a lot of people talk about Lyme arthritis, and that's kind of more well known than other types of Lyme, and people are more aware of the fact that Lyme can cause joint pain. But actually, in the UK, it's more likely that we will get neurological Lyme disease, although some people do have joint pain as well, and some people have both symptoms. So the NICE guidelines, that was the RCGP toolkit. This is taken directly from the NICE guidelines. So section 1.2.4, they advise GPs to consider the possibility of Lyme disease in people presenting with symptoms and signs that relate to one or more organ systems. So this is, you know, this systemic idea. So neurological symptoms, facial palsy, so Bell's palsy, where one side of the face droops. That's really classic of Lyme disease. Meningitis, unexplained radiculopathy, which is unexplained nervous pain, neurological pain, encephalitis and neuropsychiatric presentations. Inflammatory arthritis, including one or more joints that may be fluctuating and migratory, so moving about. Cardiac problems such as heart block or pericarditis, that's inflammation of the lining around the heart. Eye symptoms such as types of eye inflammation and skin rashes. It goes on to say if a person presents with symptoms that suggest the possibility of Lyme disease, explore how long the person has had their symptoms and if there's a history of a possible tick bite, whether they may have been exposed to activities or areas where they may have been bitten by a tick. Now, I had nearly all of those symptoms and my Lyme disease was not diagnosed. Nobody ever considered Lyme disease when I went to the doctors with all of those symptoms. And this is one of the problems with getting Lyme diagnosed, is that even though the NICE guidelines are quite clear, it quite often gets missed. So one of these slides mentioned this EM rash, the erythema migrans rash. So this is this very classic bullseye rash that you can see there in the shape of a very clear sort of bullseye with a central ring and then outer rings around it. And most people, when you talk to them about Lyme disease, they say, oh yes, the bullseye rash. Doctors will, you know, recognize the bullseye rash. However, the figures are slightly unclear, as with lots of things with Lyme, because not much research is done, but around 30 to 40% of cases don't get the rash. So not everybody who gets Lyme will get the classic diagnostic rash. The thing about the rash is if you do get it, it's important to know what to look out for and what it is if you see it. It doesn't develop immediately. It takes at least 3 days after a bite to develop. Sometimes it can take up to a month for that bullseye rash to appear. And it usually appears at the site of the tick bite. It does vary in appearance, and the next slide I'm going to show you different types. So there may not be a very clear bullseye pattern. There can be, atypical rashes, funny shaped rashes, multiple rashes, and it's usually, as I said, it's not itchy, it's not hot, and it's typically painless. As I said, it often presents initially at the site of the bite, but it can appear anywhere. And this rash, these bullseye rashes, can appear all over the body. And the clue is in the name, migrans. It means migratory rash. So it can appear in lots of different places. You can have multiple rashes. And a lot of doctors are still, saying, well, you would, if it was Lyme, you'd have a rash where you got bitten by a tick, and that isn't the case. It is a migratory rash that can travel. And the RCGP Toolkit says there may be multiple, sometimes transient erythema migrans rashes on other areas of the body. So that's recognized. And the toolkit goes on to say that the EM rash may resolve on its own without antibiotic treatment. The rash may just go, but that doesn't mean that the infection has gone. And you will still have Lyme disease that's untreated. If you have a rash and you don't treat it and the rash goes, a lot of people think, oh, well, that I didn't have Lyme and that's okay. But you do still have Lyme. So you do still need to treat that. So the behavior of the rash is key. As I said, it can look different, but it will appear 3 to 30 days. It spreads outwards, and it quite often spreads quite a lot. People, have large areas of their body sometimes covered with the rash. It can spread that much. So it's important to draw around the rash and monitor the spread and see if it's spreading. And sometimes it has a central blister in it, but sometimes it doesn't. It may not be completely circular. It might be oval or blotchy. It can be different colors. So, that's the classic red, but people sometimes experience things that look more like a bruise, sort of purplish or yellow. And so it's important, if you've been somewhere where you could have been bitten by a tick, and then 3 days to a month later, you experience this funny rash on your body, and it's accompanied by, fever, and, you get a bit of a flu or a cold. It's important to put those things together, because I had all of those things, but I didn't join them up. And that is, how you would diagnose Lyme. So these are some more pictures of the erythema migrans rash, and you can see they're on coloured skin. It looks very different. So a lot of people struggle to get a proper diagnosis because people don't recognise that that's what it is. But you can see there, it's not necessarily always the classic bullseye shape. But those are some examples. So be vigilant for any kind of circular or, misshapen rash that appears after you've been somewhere where you could have been bitten by a tick. So what to do if you feel you have been bitten recently, or, in the next few months, somebody you know sustains a tick bite. This is what you need to do. If you see the tick and you've been bitten, or you've been in a tick environment, you possibly may have the rash, but you may not. You may experience flu-like symptoms. You may start to then experience symptoms that are widespread. So you get pain, fatigue, neurological symptoms, heart symptoms, and just general malaise and feeling unwell. You need to immediately contact your GP 111 or go to A&E and seek medical advice as soon as possible, because an early diagnosis and treatment is the very best way of recovering from Lyme disease. The sooner it's treated, the better off you are. So it's absolutely imperative that if you have any suspicion at all, you go to the doctor, and you should take a copy of the NICE guidelines for Lyme disease. They're available online. You can Google NICE guidelines for Lyme disease, and they're there. And also the RCGP toolkit, which again is available freely online. would help you because, as I said, a lot of GPs have not had experience of diagnosing Lyme disease. They're not familiar with the NICE guidelines and the toolkit. They often haven't done that, and that it does get missed sometimes. So it's important to take that with you in evidence and show them why you think you've got and why you match these symptoms. So the thing to also be aware of is that the presence of the bullseye rash is diagnostic in itself and does not require a test. So if you have the bullseye rash, then you should be treated for Lyme disease immediately with antibiotics. And that is according to the NICE guidelines. They state quite clearly, diagnose and treat Lyme disease without laboratory testing in people with the erythema migrans rash. So that's very important that you know that, because often that's not done and that doesn't happen. Often doctors will send off for a test, which, as we'll see, is very murky and complex, and you may not get the treatment that you need, and you don't need a test. If you have the rash, you should be treated for Lyme, and it's important to advocate for that quite firmly. So the testing. If you don't have the diagnostic rash, if it gets missed, if, you know, maybe you're one of those percentages of people that don't get the rash, and you go into the world of testing for Lyme, it's very complex, it's very controversial, and unfortunately the tests are inaccurate. So within the NHS currently, they operate a two-tier system. So the standard NHS test is an antibody test, which is called an ELISA, an enzyme-linked immunosorbent assay. And if that's positive or it's inconclusive, then the doctor should order a second level of testing, the immunoblot, sometimes called the Western blot, which needs to be ordered from Porton Down as a specialist test that they do there. So the NICE guidelines state that if Lyme disease is suspected in people with a negative ELISA, but if you've had symptoms for 12 weeks or more, they should perform an immunoblot test. So that's often not done. The ELISA will come back as negative, and most doctors will take that as read. And even if you have symptoms, you know, it's quite often the case that you won't then automatically get sent for an immunoblot. So this is why it's really important to understand what the NICE guidelines say and advocate for yourself, because you should be getting the immunoblot test. The other thing to understand with the ELISA test is that the timing is crucial because it's an antibody test. If the test is taken too early, we won't have made the antibodies. We need at least 4 weeks after a bite for us to have produced the antibodies to get a positive test. And so that is another problem, that often doctors will do a test straight away and it comes back negative and they say you haven't got Lyme disease, but obviously you won't have made the antibodies. So if you test too early, it will be negative. The NICE guidelines and the RCGP toolkit both are very clear that there is no 100% reliable test for Lyme, and a negative test does not rule out Lyme disease. And it's important that you're aware of that because, you know, a lot of people get a negative test. I got 2 negative tests and just thought that that was that. I didn't realize that it's possible to have a false negative, which it is. So you'll see here the reason why it's possible to have a false negative. There's lots of complex reasons why the Lyme tests are not accurate, but one of them is that this sort of conflict between sensitivity, which means it catches everybody, so there's no false negatives. You're going to get a positive test if you've got it. That's sensitivity. And specificity, I can't say that word, which means it catches only the people that have it, and there's no risk of false positives. And every test is a bit of a balance between not getting false negatives and not getting false positives. So our antibody production is affected by Lyme disease, and we don't make antibodies very effectively when we have Lyme. It's one of the things that Lyme does in the body. So the ELISA test is an antibody test. So if we've had Lyme for any length of time, it's highly likely that we won't be making enough antibodies to get that positive test. So in that way, it's not sensitive enough. There's a lot of false negatives. There are alternative companies in the US and in Germany who have adjusted the sensitivity to account for that reduced antibody production, and they're considered by many people who know about Lyme disease to be more accurate, but the NHS don't recognise those tests from abroad because they believe they're not specific enough, and they think that they give too many false positives. So there's this real kind of dilemma in the world of testing for Lyme, and there's a lot of conflict and confusion about it. So Borrelia eludes the immune system, it evades the immune system. It's got lots of different ways of hiding. We've talked about the round body forms where it can go into this round body form and it's invisible to the immune system, but it has the ability to keep changing its outer surface proteins. So it's the proteins on the outer surface of the bacteria that tell the immune system, I'm an invader and I need to be attacked. But Borrelia keeps changing. It's a bit like a shapeshifter, and it confuses the immune cells and they're unable to maintain an active defense against Borrelia. And there's this paper that explains that very clearly and how that works. And it gives the analogy of our poor immune system being a little bit like the Keystone Cops, kind of policemen bumping into each other and looking at each other in confusion, trying to work out which way the suspect went because they can't see the Borrelia anymore because it keeps changing. And this is why the antibody tests are unreliable. There's another issue with testing. It's a bit complex here, but there's IgM. Antibody production is the first antibody that gets produced. When we're first bitten or we first have an infection, our body very quickly pulls together something called an IgM response, which is just good enough to sort it out. But then with a bit more time, it produces IgG antibodies, which are more robust, and they're made a bit later on in an infection. So when a doctor sees a positive IgM test, they think that's a recent infection that's only just happened, and they will be looking for an IgG positive to see that something that's been there for longer. However, in Lyme disease, it's recognized in many research papers that our IgM antibody production persists long after the infection, and you can have a positive IgM test for a very old infection. And actually the test instructions for the Porton Down immunoblot test actually acknowledges this and says that antibodies may persist for up to several years. So it's that's something else that, you know, causes a lot of confusion. A lot of doctors say, well, this isn't an old infection, this is a new infection. You can't have had, you know, long-term Lyme disease, but actually it can be if with an IgM positive. So just to reiterate, these two quotes from the RCGP Toolkit and the NICE guidelines both state that diagnosis can be difficult and should be based on a clinical history and examination because the Lyme serology, Lyme blood tests may be unreliable. A negative test does not exclude diagnosis. It's really important to understand this because often that is missed, and so you need to be able to advocate for yourself if you find yourself in that position. Again, the NICE guidelines do not rule out diagnosis if tests are negative, but there is a high clinical suspicion of Lyme disease. So Lyme must be a clinical diagnosis based on symptoms and likelihood of being bitten, as well as the test, which may or may not help. But a lot of people, you know, rely entirely on the test, and if the test is negative, they rule out Lyme disease, unfortunately. So the treatment for Lyme, if you get Lyme disease and it's diagnosed quickly and you get acute Lyme, then the NICE guidelines are for oral doxycycline antibiotics, and it should be 100 milligrams twice a day or 200 milligrams once a day for 21 days. And there's a couple of other alternatives if people don't tolerate doxycycline. Now, this is also important to know because this is much longer and much stronger doses of antibiotics than doctors would normally prescribe for infections. And many doctors underprescribe for Lyme disease because they're not aware that the NICE guidelines were revised in 2018 to recommend a much longer and a much stronger longer course of antibiotics. And many doctors will just prescribe a standard 5-day course of antibiotics, thinking that it's treated in the same way as any other infection. But studies have shown that Lyme is very resistant to antibiotics. It's difficult to eradicate, and it has a life cycle of 21 days. So you have to, take the antibiotics for the full course in order to make sure that you catch it and give yourself the very best chance of recovery. And it's important to also be aware that if your symptoms haven't resolved after the first 21 days, the NICE guidelines say you are entitled to have a second course of antibiotics for another 21 days. Now, that is clearly stated in the NICE guidelines, but it very rarely happens, and you would need to be aware of that and need to ask for it, because you wouldn't necessarily automatically expect a doctor to do that. As I say, they're not always, they haven't read the new NICE guidelines necessarily. So this is why it's so important that we know about this, so that if you still have symptoms, you go back to the doctor and say, I want the second course of antibiotics that I'm entitled to, because that is quite common that the first course doesn't eradicate it and you need a second course. So it's important to recognize that if you get early diagnosis and prompt treatment with the right antibiotics, that's the right dose, then you can, and most people do, make a full recovery. And this is why it's so critical to go to the doctor and make sure you get the right treatment, because that's your best chance of recovery very quickly and easily from Lyme. If you do take antibiotics for Lyme disease, it's important to be aware of this phenomenon called the Jarisch-Herxheimer reaction, which is understandably shortened to Herx. So people with syphilis also Herx when they are treated, because when spirochetal bacteria die, they release a lot of toxins, which triggers the immune system. So you get systemic inflammation, you get worsening of symptoms, you can get a very nasty, like a flu, like fever and chills and pains and headaches, and all your existing symptoms will get much, much worse. And it can start immediately after you've started treatment, or it can build up in your system over a few days, and then you start to feel very, very poorly. And it can be really brutal, the herxing from treating Lyme, particularly if you have a lot of bacterial load. You're killing a lot of bacteria. A lot of people feel very poorly. And it can, for us, if you already have MCAS, it can trigger a nasty flare in MCAS, because you're releasing all these toxins which our mast cells don't like. So the RCGP toolkit tells doctors to advise people of the possibility of this Herx reaction, which again very rarely happens. And a lot of people who feel very poorly stop taking the antibiotics because they don't realize that that means they're actually killing Lyme. It's one of the best diagnoses, really. If you Herx from having antibiotics, then it's likely that you have got Lyme because you're killing something. So just some statistics on acute Lyme from the Lyme Resource Centre in Scotland. In May of this year, they published their research that showed, bearing in mind that the RCGP toolkit states that late or misdiagnosed Lyme may result in persistent and debilitating symptoms, their research in Scotland found that 74% of people were not diagnosed within 4 weeks, 30% were not diagnosed for more than a year, and 16% were not diagnosed for more than 5 years. And as we've seen from the NICE guidelines, prompt antibiotic treatment reduces the risk of further symptoms and increases the chance of a complete recovery. So 69% of people had difficulty accessing treatment, 60% experienced a delay in treatment of more than a month, 45% of people had a delay of 3 months, and 17% of people had a delay of 3 years or more before they had their first antibiotic treatment for Lyme. And unsurprisingly, 78% did not fully recover after their first course of antibiotic treatment. So this is where that second course of antibiotics becomes really critical, and you need to remember to know to go and ask for that. And 61% of people surveyed said it was a lack of expertise amongst health professionals was the top barrier to them getting treatment. So this is why, again, we need to know how to advocate for ourselves and help our GPs to help us by taking the NICE guidelines and the RCGP toolkit. So chronic Lyme disease then, this is where it gets quite murky because officially the NHS does not acknowledge that chronic Lyme exists and it does not offer treatment. So patients who don't receive the full dose of antibiotics, many of them go on to experience long-term symptoms. Patients who do receive the full dose of antibiotics can also still go on to have long-term symptoms, which is known as post-treatment Lyme disease. And patients, of course, who get missed, who don't get diagnosed at all and who never get any treatment for their Lyme, they have long-term ongoing symptoms. Now, the RCGP toolkit does recognise this phenomenon of post-treatment Lyme disease, and they state that delays in diagnosis, having an increased initial severity of illness, and if you have neurological symptoms, you're more likely to develop this post-treatment long-term Lyme. And as they say, research into the causes and management of this condition is ongoing. So the symptoms of long-term Lyme disease: facial palsy, this is taken from the RCGP toolkit. So this is the recognized symptoms of long-term Lyme. Facial palsy, again, meningitis, dizziness, unexplained nerve pain, encephalitis, brain inflammation, neuropsychiatric symptoms, inflammatory arthritis, neurological conditions, cardiac problems, ME, CFS, fibromyalgia, eye inflammation, and skin rashes. So the classic symptoms that a lot of people experience are severe migrating pain that moves around, neurological symptoms like numbness and tingling, and internal tremor, so feeling as though there's a sort of shaking feeling inside, ice pick, shooting, stabbing pains, brain fog, personality changes and mood swings. Some people experience agitation, or there's something called Lyme rage, where people feel, a lot of anger and also fatigue. So according to the RCGP toolkit, diagnosis at this stage may be difficult. And again, negative blood test does not exclude diagnosis. So you'll see there's a link there to the Horowitz Lyme questionnaire. So there's a free online survey by one of the top leading Lyme disease doctors, and you can do a symptom test tracker, and they will sort of tell you whether or not it's likely that you may or may not have Lyme. Obviously, that's not a diagnosis, but it helps you to get an idea of whether you have symptoms that are, likely to be Lyme disease and whether it's worth investigating Lyme disease further. So I always suggest that as a free way of just, starting your exploration as to whether Lyme might be a factor for you. So Lyme is known as the great imitator, and this is taken from the toolkit again. Symptoms may resemble many other conditions, such as facial palsy, ME, CFS, fibromyalgia, polymyalgia rheumatica, MS, motor neuron disease, carditis, meningitis, encephalitis, autoimmune conditions, or neuropsychiatric problems. They can all be being caused by Lyme disease, but be misdiagnosed. So it's important, if you do have a long-term diagnosis of something like ME or fibromyalgia, to consider the possibility that it may be being caused by Lyme disease. So the RCGP toolkit recognizes that doctors and researchers consider that these ongoing long-term symptoms may actually be being caused by the infection remaining after treatment, the antibiotics not working. And doctors, a lot of Lyme disease doctors advocate individualized treatment regimes. So not just 21 days and that's it, but longer treatment with antibiotics. And the RCGP toolkit recognizes that many patients report significant improvement after treatment with extended antibiotics, although others do not. So current research does reflect the fact that Lyme disease is resistant to treatment, and an active infection may still be present after you've had the standard antibiotic treatment. And obviously those round body forms are very relevant here. If you've got those round body forms, they're going to be resistant. And so the research is starting to show that Lyme disease does persist after antibiotic treatment, but that is very controversial and it's not well recognized. So Dr. Tanya Dempsey, again, she says here that, recent reappraisal of trials done on post-treatment Lyme disease by Columbia University came to the conclusion that there were benefits of repeated and long-term antibiotic therapy, which she says points to the fact that post-treatment Lyme disease syndrome is a misnomer. It's not that, it's actually a chronic infection that has not been completely treated. And she says that research in mice and primates shows that the spirochetes continue to live despite antibiotic treatment, and there have been studies that show that the same thing happens in humans. However, currently, the NICE guidelines state that if you have ongoing symptoms after you've had 2 courses of antibiotics, doctors are advised not to offer any further treatment and to explain that continuing symptoms don't mean that the infection is still active. It may take many years for Lyme to resolve, and there may be, permanent damage. And they recognize that there may be ongoing symptoms like pain and fatigue, but they suggest a referral to adult social care. So currently in the UK, no treatment is offered for ongoing symptoms that persist after initial treatment. So just to say, that talking about the long-term Lyme disease, this research from the Lyme Resource Centre, 74% of people have ongoing symptoms, 56% of people had been unwell for more than 2 years, and 32% had been unwell for more than 6 years. So it is important to recognise that this post or long-term Lyme disease does persist. And in the USA, there's an estimated 2 million people, conservative estimate, with post-treatment Lyme disease. But the figures for the UK are not collected. Nobody recognises it, so nobody is recording that here. But Johns Hopkins Lyme Research Center in the US recognized that post-treatment Lyme disease is a serious and impairing condition affecting a subset of patients who remain significantly ill for 6 months or more after treatment. So if you do think that you have long-term Lyme disease and you have, ongoing symptoms long-term, the NHS do not offer any treatment for chronic Lyme disease. They don't recognize it. So some doctors are known as Lyme literate medical doctors, and they've been trained by the International Lyme and Associated Diseases Society, or ILADS for short. So an ILADS trained LLMD, Lyme literate MD, will offer long-term antibiotics, and many people seek private treatment with them for Lyme disease. And many people find that they are, they find relief from their symptoms, although it is complex. The longer it's gone on, the more co-infections you have. There's not an easy answer, but many people do find that long-term antibiotics do help them. But obviously, they're not without side effects and drawbacks, particularly for us with MCAS. However, in the UK, if doctors are found to be following the ILADS treatment protocols, they do risk being struck off by the GMC. So it's quite a controversial area because they're not really allowed to prescribe these long-term antibiotics, but many people find they improve. Some people use herbal remedies. Now, there is good research that shows that a lot of herbs do kill Lyme disease as well as antibiotics do, things like Chinese skullcap, Japanese knotweed, artemisinin, cryptolepis, Cistus incanus, cat's claw. One of the herbalists in the UK, it's in Scotland, Napier's, they do very good Lyme disease specialist treatment with herbs. And Stephen Booner published a number of books on treating Lyme disease with herbs. And a lot of people go down that route and recover very well, as long as they remember to also treat the co-infections, to not just use herbs that treat Borrelia, but other herbs for Bartonella and Babesia and and the other co-infections. So those are the options, really. It's limited in terms of treatment. You need to find a Lyme literate doctor who can treat you with long-term antibiotics or go down the herbal route. So we've seen that Lyme disease can suppress and confuse the antibody producing part of our immune system, the adaptive immune system, but it also provokes our innate immune system, of which the mast cells are part, and causes this systemic inflammation and systemic mast cell activation. And the majority of the Lyme symptoms are the result of inflammation that's migrating around different parts of the body. Wherever the Lyme is living, the immune system and our mast cells are trying to fight it constantly, and that's why we get these symptoms and the reason why it's migratory. So there's many mechanisms by which Lyme can trigger autoimmunity as well. So Daisy Ilchovska, she publishes a lot of research on how Lyme bacteria can trigger our bodies to become autoimmune or trigger autoimmune conditions in our bodies. So it really messes with our immune system in lots of ways. And through the process of molecular mimicry, you know, it mistakenly attacks our tissues, thinking that it's the Borrelia that it's attacking. There's also alpha-gal syndrome, of course, which is a rare reaction that triggers a very severe meat allergy, which is recognized. Lyme disease does cause people to develop alpha-gal syndrome, where they can't tolerate any meat or animal products because they become very severely reactive to alpha-gal, which is a protein in animal products. And of course, mast cell activation syndrome. Mast cells become upregulated by this constant presence of Lyme bacteria and the toxins that they're releasing. So Dr. Tanya Dempsey, who is a leading MCAS specialist, she says there's a significant subset of patients with chronic Lyme symptoms who develop mast cell activation syndrome. And the symptoms of MCAS overlap with the symptoms of chronic Lyme. And there are patients who will just have MCAS without any Lyme, but there are other people who have Lyme and MCAS, and you need to be looking at treatment for both. So she goes on to explain that the mast cells release, I think it's more now, that they think it's more than 200 different chemicals, including histamine, when they're attempting to fight off something foreign, in this case, Lyme disease. Lyme disease will trigger mast cells to degranulate and release those cytokines. And if the root cause of what's triggering your mast cells is Lyme disease, then that needs to be treated as well. So that's Tanya Dempsey's take on it. This particular research paper that was published in 1999 in Infection and Immunity Journal, the title says it all, Borrelia burgdorferi spirochetes induce mast cell activation and cytokine release. So it's been shown in studies that the presence of Borrelia bacteria in the body induce mast cell degranulation and TNF-alpha, a type of cytokine release in mast cells. So there is quite clearly a connection between the Borrelia bacteria and mast cell degranulation. So Tanya Dempsey, again, talking about Bartonella, which, is one of these co-infections. And she says, again, that Bartonella triggers mast cell activation syndrome as well. So the mast cells are a first line of defense, and when they come up against Bartonella, they will again release those cytokines and signaling molecules and rally the immune system to neutralize the threat. However, she explains that the problem is the mast cells become hypersensitized or hijacked and become overreactive because they're constantly exposed to Bartonella or Borrelia or whichever infection you've got. You're repeatedly exposing the mast cells to that bacteria, and she says it creates an environment that's ripe for MCAS. Dr. Bill Rawls is another Lyme disease specialist, and he says the signs and symptoms associated with mast cell overactivity are not uncommon in people struggling with chronic Lyme disease. Microbes and other stress factors associated with these conditions disrupt the immune system functions and push certain aspects of the immune system, like mast cells, into overdrive. And Dr. Todd Madaris, again, another Lyme specialist, about half of the patients I see with tick-borne infections also experience MCAS. So you can see there's a lot of people who are treating Lyme can see that there's a lot of overlap with MCAS. And Dr. Dempsey also sees an overlap between Lyme disease and POTS, postural orthostatic tachycardia syndrome. She says POTS can be triggered by many different things, including infections. Within the category of infections, I've seen POTS triggered by viruses such as Epstein-Barr and bacteria such as Bartonella, Borrelia, and strep, and parasites like Babesia. So you can see there's a lot of tick-borne culprits in there that she says potentially can be triggering for POTS. And she says at least 50% of her patients with Lyme also have POTS. And she believes that the mast cell component is also significant in Lyme patients with POTS. And so treating the MCAS and treating the Lyme can, they all interrelate and interlink, in her opinion. So in summary then, chronic Lyme disease is really complex and multifactorial. There can be lots of things going on. You can have co-infections, so things like Bartonella and Babesia. There can be mold illness involved, and that's a whole other discussion about how mold and Lyme interconnect with one another. Lyme disease can trigger autoimmunity. It can trigger nervous system dysregulation and trigger things like POTS and dysautonomia. It can trigger immune system dysregulation, things like MCAS. It can lead to nutritional deficiencies. So the Borrelia bacteria, for example, it likes to gobble up magnesium. So a lot of people with Lyme are deficient in magnesium, and a lot of the symptoms that we're experiencing can be due to nutritional deficiencies that the Lyme is gobbling up, our fats as well. Lyme will eat fats. And so we can be deficient in fats and deficient in magnesium and other nutrients. And also we have tissue damage going on because we've got those spirochete bacteria burrowing into our tissues and creating inflammation. So there's not one magic bullet that can treat complex Lyme disease, but if you work multisystemically and multifactorially, you work on killing the bacteria and other pathogens that you might have, reducing the inflammation and helping the immune system to balance, treating the MCAS and calming that down a bit, detoxing the body of Lyme toxins is a big part of it, repairing the tissue damage, repairing the gut microbiome where the Lyme colonizes in the gut and causes dysbiosis, repairing nutritional deficiencies and rebalancing the nervous system dysregulation. If you work on all of those different angles with Lyme disease, you can make significant progress, and it needs a multi-systemic and a kind of multifactorial approach. But as I said, I found personally that by treating Lyme disease, my MCAS has improved significantly, and that's helped me a lot to calm my mast cells down. So there's some of the resources there that I've used to talk about the MCAS and the connection between MCAS and Lyme disease. It's important to say, that that's all evidenced by these doctors who are working in the field and by research that's happening at the moment. And there's a page here of other resources about Lyme disease where you can find out more. Lyme Disease UK is a really good website. As I say, the RCGP Toolkit is available. It's freely available. Anybody can do it. And there's the iLads website. Caldwell Lyme Co. They have some good information, and Dr. Tanya Dempsey, Dr. Rawls, Dr. Marty Ross, and Dr. Todd Madaris, they all have a lot of good information. And AONM here in the UK, the Academy of Nutritional Medicine, they have a lot of webinars, a lot of lectures about Lyme disease, and also access to testing through them as well. So those are my contact details if people want to get in touch. I know we've overrun. I'm really sorry about that, but I hope you found it useful. I hope you found it helpful and interesting. If you've got questions, I'm conscious, I don't want to keep people any longer, but please feel free to email me and contact me if you want to ask questions. I'm happy for you to do that if there isn't time to answer them tonight.